Hey, we know that the current healthcare model in the United States is not ideal to say the least, and some would even call it broken. So, what can we do to bring about a new model of healthcare that will lead us to healthier and happier lives, and even ones where we live longer? Check out this podcast with Dr. Firouz Daneshgari, who is one of the pioneers of changing the system towards one where consumers are more informed and are taking charge of their own health much earlier in life. If you're looking for thicker, fuller, and stronger hair, then make sure to check out Fully Vital. We've created a whole set of fully natural products that combine together to stimulate the hair follicles in multiple ways to get you the thicker, fuller, and stronger hair that you deserve. So make sure to check out Fully Vital and use code ANTIAGINGHACKS for 15% off. If you're enjoying this channel, then make sure to click the subscribe button down below so you can get notified when we release new episodes. Our goal on this show is to help you look and feel younger and live your best life. So make sure to hit subscribe down below so you can get notified when we release new episodes. With that said, let's get right into the episode. Hello and welcome back to the Anti-Aging Hacks podcast. Today, my guest is Dr. Firouz Daneshgari, who is a surgeon, scientist, educator, and entrepreneur who has worked at the University of Colorado, Cleveland Clinic, and Case Western Reserve University. He's published more than 200 scientific articles, led numerous scientific and clinical panels, and trained hundreds of students, residents, fellows, and junior faculty. Following implementation of the Affordable Care Act and approval of its mandates by the Supreme Court during 2010 to 2012, he founded Bowtie Medical to create systematic innovations for bringing efficiency and value into the healthcare delivery system. He's recently written a book called Health Guardianship, The Remedy to a Sickcare System. Dr. Daneshgari also shares his views on healthcare and the path forward through his podcast, Why Can't We Have It All? The Missing Pieces in Our Healthcare. With that said, Dr. Firouz Daneshgari, welcome to the Anti-Aging Hacks podcast.
Thank you very much, Faraz. It's a pleasure and privilege to be here.
So I love what you're doing, by the way. And let's start off with your introduction to the audience and your medical history, background, and how you got into the space that you're in now.
Sure. Hopefully very short. I was born in Iran, and post 1979, my family moved to U.S. We settled in Chicago, where I went to did my training at Loyola University of Chicago, then moved to Colorado, where I became a urologist and did a fellowship at UT Southwestern. I think is a part of my upbringing that when I see systematic misalignments, I become very attracted and see how it could be fixed, because the systematic misalignments create significant inefficiencies that everyone suffers. So the first time when I came out of the fellowship, I saw that misalignment between the urology and gynecologists. They were fighting for who would take care of women with female pelvic floor disorders. Mm-hmm. So I came up with a simple concept of rather than fighting with each other, we can join each other, because the patients don't care what ologist takes care of them. They want to go to a good doctor to take care of them. So that brought me to Cleveland, where at Cleveland Clinic, I founded the first fellowship program, a joint between urology and gynecology. This became very popular. I promoted it and so forth. Within 10 years, became a new board certifications between the two specialties. So I'm double board certified in urology and female pelvic reconstructive surgery. Mm-hmm. So following that, I became the chair, as you mentioned, in the couple of departments. That's the kind of the natural history of progression in academic medicine. Became the chair at Case Western Reserve University. And because of the success of the program, I was selected to serve on the board of a large hospital system, about $3 billion a year revenue. During that process, my eyes opened to the other side of the healthcare, and that was the business of healthcare. Mm-hmm. And soon I realized through the interactions I had with board members, and frankly, the CEO told me, he said, when I mentioned to him that I think we are in the business of Sickcare because we are benefiting from all the clinical volume which do for people who are sick. And I tested the theory. I said, if I'm a good scientist, I've been funded by NIH for the past 20 years. If I go and discover a potion that I give to all people in Northeast Ohio that become healthy, the hospitals will go bankrupt. And the CEO of this major system said, you're right. But what you have to realize is the healthcare currently in the US is delivered through 5,000 hospitals, and each of them are financial institutions. If they don't deliver a healthy margin, they won't exist, and I won't have a job as the CEO. So I asked, so you think, or you're telling me that the aim of the healthcare in the US has become for 5,000 financial institutions to survive and not people become healthier? He said, that is one way you can interpret that. So that, in order for me to understand why, answering really to the three questions, why we have become the most expensive healthcare in the world, we spend 300 to 500% more than the rest of the world. European, Japanese, we spend 11,000 per capita. They are spending between 3,000 to 5,000 per capita. Number one, despite the fact we have some of the best trained people and some of the most technology. And what I discovered very soon, in order to do that, I was talking to the vice dean of the School of Management. He suggested that I come and investigate from a business perspective rather than the scientist in a clinician. So I went to an executive MBA program where I spent the 2 years and this asking ourselves why the hospitals basically turned from the charity houses of the late 19th century to financial institutions. As you and I were talking before the recording of the podcast, you see that trend now in other countries, in India, in Europe, and so forth. The hospital becoming basically financial institutions where use the clinical volume for deriving revenue and margins. I'm a capitalist. I'm all for profit. But the problem with the healthcare is when you use the healthcare services as a source of revenue, everything we do in healthcare and the sick care has side effects or complications. That drives harms to people. And that's why in the US, I'm embarrassed to say that the medical errors has become the number 3 cause of death in the US. After cardiovascular cancer, medical errors are. So that is where the aha eureka moment in my mind was opening, that yes, we have turned basically the hospitals to financial institutions where the clinical volume is dry. And I saw that in my daily interactions, both as the chair of a department where I would basically monitor how many surgeries, how many MRIs, how many labs my faculty have ordered. And if they fell behind the threshold, I would go and threaten them that I'm going to reduce their salary. And as a board member, I participated in purchasing some practices because the hospital soon they realized that in order to feed this monster, they have to control the primary care. Primary care is the source that basically refers. So when I was participating in the purchase of the primary care, the first day we go, we say, hello, Dr. XYZ and your partners, welcome aboard. 2 weeks later, we'll show up with a bunch of MBAs and show them your numbers don't look good. You need to see more than 30, 40 patients a day. And when they said, well, I can't take care of the patients, I said, really, all you need to do to refer them to me. If there is a woman comes in with the blood in the urine, just don't treat them with antibiotics. Send them to me. I will do a cystoscopy, CT urogram, basically will create clinical volume. So that comes to the what is the simple 3-factorial thing I say is we have become the most expensive and mispriced system in the world. And the reason for that we are so expensive because through this mechanics that I explained, we are generating more than 50% of waste. 50% of what is done in the current system in the US by independent research from Dartmouth Institute of Health and the plenty of applications of waste. The reason this waste is basically perpetually produced is because there are systematic misalignments. So that mechanics that I explained, we have turned in majority of the markets, more than 70% of the patients are employed by the hospitals. Therefore, they have become basically the agent of the hospitals rather than the agent of the patient to increase the clinical volume.
Oh, the doctors, 70% of doctors are employed by hospitals.
That's right.
So they're acting on behalf of the hospitals and doing whatever the CEO tells them to do.
Absolutely. And people in my former position, CEO tells me as the chair of department, and I'll go basically deliver that to the doctors. So the second misalignment that I discovered during the studies is that misalignment, frankly, between the payer and the consumer. You can turn this. We are spending close to about $4 trillion on healthcare. It's the largest industry in this country.
Wow.
You can put those $4 trillion into three buckets. A bucket that concludes all the providers, hospitals, doctors, drug companies, and so forth. The second bucket is the consumer that 100 years ago, if you and I lived in the same neighborhood, I was your physician, I knew you, I knew your parents, we bought from the same grocery store, and I rendered my expertise with that knowledge. Since World War II, a third bucket was created in the middle called the payer. For 2/3 of Americans, employers now they are the sponsor of the healthcare insurance. For 1/3, about close to 100, is the federal government through the Medicare and Medicaid. So these three buckets, the misalignment has been caused between the payer and the consumer because the insurance companies are paying for that wasteful behavior of the hospitals from the pocket of the consumer. Because the insurance company it's not their money. It's basically they go to your employer, they give you a benefit package with extra, basically that cost. The employer splits the cost between the employee and themselves. The employee pays 20, 30% of the premium, employer pays the rest. This payer delivers that package to the provider. Provider creates 50% of the waste. Next year, the payer, the insurance company, comes back to the employer and says, guess what? Your prices are going up 20%, right? Because the insurance companies, they take their part of it, but the money that is really spent or is paid for the waste of the provider segment is the earnings that every American makes on an hourly basis. Correct. The average earning of that employee in the U.S. is $25. $11 of that is spent on the Sickcare.
Jeez, that's huge. Why? So obviously, as you said, the hospitals have an incentive because they're now financial institutions to charge more, to do more scans or whatever these devices that they have, these fancy devices in there, to run you through those and have more exams and whatever else needs to be done, so to speak, so they can charge you more. But also, like when you have one of these scans, like an MRI scan, why does it cost so much? The machine's already there. It's paid for. Let's say you paid $1 million for it. Maybe you did. But there's been 1,000 people through it in 3 days. So why are you still charging $1,500 for an MRI, for example?
Right. So you're Faraz, you're pointing out to the second source of waste, and that is the price variability. So again, about 10, 12 years ago, this may not be might not have been as obvious as it is today, because 5 miles from where you live and 5 miles from where I live, you couldn't go, either of us, we can go and get an MRI of our knee or neck or whatever for $300 or $400. Or if we go to one of these hospital systems, we will pay between $3,000 to $5,000.
Wow.
So the price, there is a 1,500% price variability for all the services in every market. And the reason it has existed because it's been hidden from the consumer. Again, between those three buckets, if you remember, on the right side, the provider, on the far left side, the consumer, the payer has popped inside. The payer basically has hidden that number from the consumer. So majority of employees, the consumer who goes to the hospital to get the MRI, they never ever ask how much this MRI costs. Right. Because the only sensitivity they have is how much I'm paying out of my pocket, how much is my deductible. Right. So that is the misalignment that has been caused by the third-party payer. In every part of our lives, when we go grocery shopping, car shopping, TV shopping, we have a direct interaction with the person who's selling it to us. In the healthcare is the only industry we have delegated that responsibility, or we haven't delegated, it's been taken away from us, to basically a third-party payer who negotiates the prices with the provider And it's the only industry or service in the world that when we go, we sign a white paper that I'll pay all the prices, everything you do, and I'm financially responsible for that. And that
Right.
is the second really sad consequence of this now is the medical expenses, medical bills are the number one cause of personal bankruptcies in the US.
Wow.
And yeah.
Why hasn't there been public opposition? I know that people, even though you're just paying your share out of pocket, um, but still, like these, as you're saying, these bills add up even to the individuals. There's gross inefficiencies in the system, agreed. But even the people that are paying for these health, challenges and some of these operations and procedures, long term, it catches up. And so at some point you become very aware of what you're paying. And so why hasn't been there more public upheaval, more talks, more debates? It seems like it's just swept under the rug and everybody's fine with the status quo.
This comes to the kind of the political level, which is kind of a little bit above my pay grade, as they say. But nevertheless, you're pointing out to why, as a nation, we have tolerated such a significant amount of waste.
Yeah.
I'll give you one example to magnify the if we eliminate this waste out of the healthcare system, that is today's dollars is $2 trillion. $2 trillion becomes number 8 or 9 largest economy in the world. It is more than Russia's GDP.
Wow.
So the saving of the healthcare here, we can go and buy a couple of other countries, frankly, or buy their GDPs.
Yeah.
The reason for the tolerance of this is number historical, and that's why I have written in my book, why we basically didn't go to the path like Europeans did to single payer, or why, and so forth. Rather than blaming, I think, the historical things and so forth, when I was discovering these elements of this sickness, if you will, I went around the world with the concept that there may be some solution someone else has discovered. I traveled. I had the privilege of being visiting professors. I've trained people all over the world, so they invite me to go. I went to China, to Taiwan. Taiwan has been proposed in some circles as the model we can follow. I was trained in Europe, so I'm very familiar with that Bismarck single payer, single provider model. But the last stop I had was in Brazil. In Brazil, there's a constitutional mandate that government provide free healthcare for every Brazilian citizen. So at the dinner I had with the coordinator of the healthcare for the largest state, is called São Paulo state. His name was Gustav. He's an orthopedic physician. So I said, Gustav, do you provide free healthcare to all your citizens? He said, heck no. I said, but you have a constitutional mandate. You're legally liable. It's in my American understanding of legality. He said, yeah. I said, I can come and sue you. He said, yeah, you can do, but we don't have the money. I said, what do you mean? He said, for the 42 million population I have my budget is 8 billion. The first 2 billion goes right off the bat to the medications you guys keep creating and our doctors keep reading in their journals and so forth. And I said, so what is the solution? This is 2010 or 11. He pulled out his iPhone out of his pocket and he said, go and innovate. I said, what do you mean? He said, you guys have the best trained people. You have the most money. You have the largest market. Go and figure out how we can create the next model of the healthcare that has all the goods of the technology and the wonderfully best trained people and so forth, but get rid of the problematic part of it. So during that trip, I was reading a book from Peter Drucker, who is the dean of schools, the schools of businesses. The title of the Peter Drucker's book is Post-Capitalistic Society. And the theme of the book is, although the capitalistic system has not delivered the utopia, nevertheless is the best system because it has created the most prosperity in the world among all the systems. Our job is not to go back and go back to 100 years ago. Our job is to figure out how we can basically build upon the shoulder of the system to make it a much better system that everyone has a happy and fulfilled life. So this kind of dots got connected in my mind that yes, I believe in American ingenuity. I think when we put our brain into something, we would basically figure it out. And thank goodness, our market are so smart. If you deliver a value, the markets will deliver the rewards in terms of waste. And if no one believes me, look at the past 30 years, that the solutions that came out of garages, that led to Apple and Google and Amazon, and most recently Tesla, has blown out of basically delivered the value that the market was waiting for. And therefore, those companies have become, the $1 trillion worth companies. I believe, as you mentioned, I think before we started recording, this solution that we are discovering in the US healthcare not only will save our country $2 trillion a year, will become the beacon of leadership and hope for the rest of the world who follows us. And this would, the next model of the healthcare created will become the next major source of value and wealth generation for our country, for America, and for the rest of the world. That frankly will put the previous companies into kind of little ones, because the worldwide opportunity here is close to $10 trillion.
Wow. Yeah.
But I'm going to connect this, and I'm hoping you're going to ask me, but I'm going to connect this to not to the financial part of it, to really what drives my heart, and that is releasing the biological potential we as humans have. As you have seen in the book, I propose that if we do this correctly, we basically change our mindset from dealing with sickness into improving health guardianship. There are tremendous scientific evidence. Every one of us have seen people who live to age of 100, 105, 110, that most of us could live to age of 100 free from chronic conditions. So at the end of the book, I have put a picture of a stakeholder meeting of Hathaway Brown Company, that Warren Buffett at the age of 90 and Charles Munger at the age of 97, they're running that meeting, teaching the rest of the fourth generations how to be smart and how to make money. And they're their 10th decade of their lives. So to me, this transition from a sick care to a health guardianship is a transition that would release our biological potentials and not basically freeing us up from this massive burden of the chronic conditions, obesity, diabetes, cardiovascular, which are nearly 100% preventable.
And so so I want to explore that quite a bit, by the way. And so these conditions that we talk about, the big 4 killers, if you have, or the big 6 killers, cardiovascular, cancer, accidents, stroke, Alzheimer's, diabetes, some of these are obviously, they take a long time to manifest, and diabetes can manifest earlier. You can get in your 30s or 40s, but typically heart disease comes later, and strokes also, I believe, happen mid-age and beyond for the most part. And so these are diseases associated with aging. And most people, unfortunately, don't know that this is going on in their bodies until there's a big warning sign. And then they have to go to the doctor and go, oh my God, I have cancer or something else, or my heart's blocked, or arteries are blocked, I should say. And so in terms of preventative medicine, when you go to a doctor for your healthcare exam, you just get your blood test done, and pretty much that's how it is. And sometimes you get prostate tests after a certain age, and that's great. But how can we become more aligned with preventing some of these big diseases and catching them super early? And I think you're working on some of this. So what's the new model that you believe is going to be successful for us?
Sure. So I'll give you a historical example, and I'll tell you what the model is. If you go back to the turn of the past century, the number 1 cause of death was infectious diseases. Number 2 was cardiovascular, 3 cancer, 4 trauma. So with infectious diseases, very soon we realized the best, the most efficient, the best return of investment is to create public health, to deliver a systematic clean water, clean food, vaccination, and so forth.
Mhm.
And we established the public health as a part of our federal government, local, and so forth. And therefore, now we feel very comfortable. We go around during the tap water, we go to restaurants because a system was built behind us to make sure that the fish in the restaurant is not rotten, right?
Mhm.
And you and I have traveled internationally. You know, when you go to some countries and so forth, you don't have that liberty, right?
Yeah, yeah.
Drink the water, you drink the food, and you pay the heavy price of being in the toilet, right?
True.
So the public health has delivered the most return on investment in eradicating the number one cause of death. So no longer infectious diseases are number one cause of death. Then the rest of the 100 years we spend on discovering what causes the cardiovascular, cancer, and trauma. Trauma was, again, another easy one. The speed control, seat belts, helmets has reduced the mortality by 30-40%.
Mhm.
With the other conditions, such as cardiovascular, cancer, and the rest of them, we have built a system that I call them a Sickcare system. And we did that appropriately because we wanted to discover how the arteries get plugged, why the cancer develops, the cervical cancer, breast cancer, prostate cancer. And during that process, we did two things. One is we added to our scientific knowledge of how these diseases are basically are developing, right? How it leads to a first symptom. But more importantly, we build business models called hospitals that financially benefit from delivering services related to those diseases after they have appeared, after
Right.
you have the symptom, after you get the chest pain, after you have so forth. So this uh, introduction gives me the insight into the basically the model, and I present it as a bow tie model. That's why I named the startup as a bow tie. If you Google the bow tie risk assessment, is the shape of a bow tie. The knot or the center of the bow tie is the event you want to prevent. And I'll give you a couple of other examples, and I'll come back to healthcare. If the event is a chemical spill, is a fire, or is airline crash, those industries, they have done every effort they do on the left side of the bow tie to make sure that the event would not happen. Because for airline industry, it is unacceptable to catch a fire on the engine at 30,000 feet elevations.
Mhm.
Therefore, the entire industry is focused on the pre-flight safety checklist, and so forth, to the point that the air travel has become the safest mode of transportation in the world within the short period of 118 years. The very
Mhm.
first flight took place on December of 1903. And the fire, the same thing. When we came out of the caves and we lived in the structures, we realized the fire is a risk, right? Now we have integrated the risk mitigation for fire inside our daily lives. We all have smoke detectors. We teach our kids how to prevent fire, how to escape in the back door, and the fire department, education, engagement, and regulations. You cannot build on a structure without meeting the codes for the fire department. That's why the 110th floor of Sears Tower or Empire State have stood there without the fire.
Mhm.
100 years ago, we didn't know this. That's why, if you remember the Chicago fire, it started, right? Now, because of that learning, we have made the fire literally in our big societies, is multi-million, living cities, New York, Los Angeles, Chicago, is, under control, right? We have brought the risk. If you take the same approach to healthcare or the same view of the healthcare, we have built a sick care system that waits until that event happens, until you become diabetic, you're obese, and then it starts basically scrambling for solution.
Mhm.
At the same time, over the past 100 years, however, we have discovered more information about the risks of those diseases. The 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 missing point, that's why I call the podcast the missing piece, is that we don't have organizations and institutions who can benefit financially from risk mitigation in healthcare. What we call today in the preventive care is really feeding into the sick care. I go
Mhm.
and you do a mammography if you're a woman, and that creates a biopsy of the breast and the rest of it. Whereas we know the risk for cancer, as you know, Jolie Angelica, I think she went and she said she did a double mastectomy because she discovered that she has the genes that promotes her. We have more, frankly, scientifically, as a scientist, I can attest to this. We have more scientific information how to risk mitigate Alzheimer, cardiovascular, diabetes, obesity, what you call the 7 killers, and we know how to treat them. The missing piece is we don't have institutions, organizations to put this in a structure where they can deliver an efficient, effective risk mitigation of this thing. We are missing that kind of public health equivalence. I'm not proposing for us to do this, the government, because this is very much like any other entrepreneurial thing, will start and has started, frankly, with companies such as Bowtie, and there are a few other companies, to move the view from Sickcare into healthcare. From the right side of the left side of the Bowtie, depending on whether you're wearing or you're looking at it, to the right side of the Bowtie. If we as a society, we said it is unacceptable, I have 2 children, I don't know if you have children, it is unacceptable for my child who is a 20-year-old to become diabetic, obese at the age of 60. If I put that as a societal or a family target, by God, that person's risk of becoming obese or diabetic is going to come close to zero, very much like the airline industry has done. Because the risks are known. What we need to focus and invest is risk mitigation, services, industries, organizations, and so forth.
Got it. And there's an aspect of the consumer in this too, as well, right? So I know that in the United States, when you travel the world, which I know you have, you see in other places, people are at least skinny. They're very slim. And I'm not saying that's a direct correlation of health, but diabetes and obesity do actually factor in to your long-term health in a negative way. So that's a correlation there. So you see people walk more, they're having, more friends, they have more purpose. And so when you come back here, in America, at least, we are sicker as a society than anywhere else, I believe. And so if that's the case, there's also this concept of educating the consumer, right? So how does a consumer even get motivated to come to see a doctor 20 years before they're at risk for diabetes, right? At 25 years old, or at 35 or 40, how am I motivated to go to a different model because I feel limitless? I feel like invincible at this point, or people do in the 20s and 30s. So how would you address people's behavior, I guess?
So this goes back again, the previous, I think if you look at the other successful models that we have succeeded, can you imagine? And that, I think that gives us a little blueprint how we can do this. And it is difficult, I agree. But first thing first, can you imagine how difficult would have been if, when we discovered in the infectious diseases, rely on individual attempts that you go and boil your water, make sure your food is clean, rather than solving it at the systematic level. Public health was simple, was easy. We could handle it. Basically, we put the water preparation in every city, at the systematic level we could, but that trickled down to individual basically behavior, right? Every employee, you go to the bathroom, all the employees have to wash their hands. We teach our children how to wash their hands, and we didn't notice all this stuff a year ago. What I'm saying is there are a combination of top to bottom approach and bottom to top approach. Top to bottom approach is disruptive innovation of the healthcare organizations that could, and I've explained this in the book, and I'll be happy to come back and explain it in terms of the model, is, as I said, we are the, number one, we are the most expensive because the system creates perpetual waste. The waste is because of the misalignments. The solution is the reverse of this. In Bowtie Medical, we, again, and a few other companies, first, we are removing the misalignment from between the primary care and the patients. as I explained with my hands, the movement has started in primary care called direct primary care, that the primary care, rather than being the agent of the hospital, is now hired by the individual for a monthly fee, $100 per member. The doctor now has become, we started at both our medical with this one, but very soon we moved this into a virtual primary care because the limitations of the physical thing was cumbersome. And number one, no more than 90% of the interaction between the doctor and the patient is nothing but exchange of information. The easiest, the cheapest way, and frankly, the most person-centered way to collect the information is doing through virtual. So
through virtual. Like a Zoom call, for example.
Correct. A virtual primary care. So now we deliver virtual comprehensive care, actually primary care and the specialty care in over 30 states. We have members. So the first misalignment to be fixed is that one. The next, and therefore this doctor basically delivers the care 24/7. But then that is not all the needs a person has. So what we have built, or what needs to be built, the current Sickcare model is I call them a Sickcare because it's a provider-centric. If you have a need, you have to come to my appointment, my time, and that is from 9 to 4, 9 to 5. So when you get up in the morning, you or your family member, you have symptoms, the chances are you can't get to see your primary care because they have to see that 50, 60 patients a day. You're forced to go to an urgent care or the ER. The cost goes up, 5, 6 times. So this kind of the subscription-based, virtual first delivery of the care wellness services is the first cornerstone. So you as a person, you and your family are a member, or you have a subscription, you have relationship with the care team, which I will explain later what the care team function is. It's not only being the doctor, but also customizing your care plans. If you become a member, you have problem with your diet, with your eating habit, with your GI system. You want to be healthy, but you don't know how to do. This team now becomes your health coach. This team becomes a large portion of people who have suffered from diabetes or obesity have some mental health issues. So we have integrated wellness, primary care, mental health, and common specialty care into this subscription model. And is a unlimited use. You just pay a fee and use it as much as you do. It's not a fee for service, again, contrast to the Sickcare system. The Sickcare system is for every time you come in, I'll charge. That is the first cornerstone, to separate the primary care and build what I call the health guardianship. This care team now is the guardian of your health and your wellness.
And so it's physical and mental, right? So you're addressing both types of health in one practice, in one office, by people that you know, like, and trust. So that's great. And then the doctor that you work with is the one person that, like you said, it used to be in the olden days where you knew them, they knew your family, and they took care of your whole family. And so I like that model because it builds a relationship. And this, I assume this would be so much easier if your insurance would pay for this, right? Because right now I assume that you have to pay out of pocket for this, for the subscription.
So the second part of it, that's correct. The second part of it is that this care team, in order to, there's what we have done, we have added the component of what we call the health guardians. These are nurses, medical advisors, health coaches that are there, and they have been extensively trained in identifying the waste and unnecessary care in the system. So now you are my member, we have interacted, I have delivered services, so hopefully I have earned your trust. So next time you come in, you need to have an MRI, you need an endoscopy or something. You come to me and say, or during our interaction, I think you need an MRI because you went on a skiing and you hurt your knee or whatever. Then our job becomes to find the highest quality, the fairest price. I would educate you and give you the options that Faraz, or if you have family members, these are the 3 options. The MRI, one is 3,000, one is 300, and these are true examples. Wow. If you want to have your knee surgery, this is the quality ranking of the hospital, quality ranking of the surgeon, and the prices. I'll give you the examples. I have an example of a hospital ranking 75 percentile, the surgeon ranking 50th percentile. The price for knee replacement is $110,000. The second one, the quality ranking was 95%, the 98%, the price was $40,000.
Wow.
So as you could see, when I presented in this fashion, the choices become so simple. But nevertheless, the first provider, the first system, has the dominance in that market because they have the highest marketing budget. They're all over the TV. They're all over. We are providing the first class care and all that other stuff. But because they're aware that the consumer doesn't ask about the price, that's how they're doing. So the job of our guardian becomes to basically create this awareness. And what I say is consumer becomes an informed customer. So when we do this, we have data. There are other things that have shown that we can save 20, 30, 40, 50% savings. So the next step for us was to form an insurance actually around this, because I want to deliver the savings to the end user consumer, not to the insurance company, to the employee and the employers. And we are gaining significant traction now in a local market in Ohio, where we are focusing, to the point that I have seen in the very short period of time we started in January, I'm seeing the realignment between the employer and employees. In the beginning, when we were going to the companies, the employees said, I don't care if you save money for my employer because he doesn't pass it to me. Now the employers coming back say, no, if you go to a surgery where it cost us $10,000 less, I'm going to waive your deductible. You don't have to pay the $2,000 out of your pocket.
So, now it's making a difference.
Yes. So what I'm saying is this misalignment we have basically reconfigured. The first misalignment is to bring the doctor and the patient together, equip the doctor with the information and insight about the waste of the system, deliver those savings under a captive self-insured into the employer, and this becomes and frankly, our members, they can go anywhere. All we do, we give them the choice, basically the information on the quality and the price. Open network, you can go anywhere. And that is the foundation for what I believe will become the free market, efficient market for healthcare that would, again, lower the cost by 50%. And again, for us, I don't have to go to Mars to bring the data back. Europeans are doing this with 50%. To deliver the cost by 50%, create, most importantly to me, to provide this a holistic care and wellness package that will keep us, we call it the right care at the right time at the right place, based on the consumer. And hopefully, again, explore the biological potential that all of us have.
Totally. You know what you said just now, I want to come back to, because I've had experiences where I'm a soccer player. And so I played, even after college, I played for many years. And there was one day I remember we were playing on a field and had a scuffle, was running down the field, pushing defenders to try to score a goal. And I fell on my hand. And for 1 second, I think my elbow popped out and it went back in, right? But I felt a lot of pain in my elbow, a lot of searing pain. And so I decided to leave the field and I drove myself to an ER, and they basically took an x-ray and then they put a cast on, said, you're fine, it's going to be fine. The tendons are hurt or whatever, and just wear this cast for a couple of weeks and it's all good. And so that's all I did. And I had to wait for 2 hours for the ER too. I probably spent an hour with everybody in there and waited for 2 hours. So in 3 hours, I was done. And then 2 weeks later, I got a bill. It was $1,300. And this was pre-inflation days. This was 15 years ago. And I'm going, $1,300 seems like a lot of money. Yes, I can afford to pay it. Thankfully, I have a good job. But it just seemed like that was such a waste. And to your point, if there's if let's say it's not an ER situation, right? Let's say I do need to get an X-ray of a body part, and it's somewhere, or an MRI, and somewhere it costs $300 and somewhere it costs $5,000. I would have never even known. Like, consumers don't have the slightest clue how much things cost in the healthcare world, these scans or MRIs or whatever things are happening, or other devices that they need to use. And so, one, somebody to explain to you, hey, you can save $3,000 on something would be so beneficial. And then also just having that relationship long term. And then the third thing I think you mentioned is working with employers and getting people more aware of how much savings they could have. And then if people start to take more attention on their health and start to take some of the initiative, then it's going to be less, turning on Netflix every evening or watching a football game to number brains, and more about how can I be more in charge of my own health and save money for myself and for my employer, and also reduce waste, because people want to do good things, I believe, in the world, and wastage nobody likes. And so, yeah, this is really cool. And so in terms of the employers, how are you, I didn't catch how you're working with them. So is it that somebody could sign up for a plan with the employer and it's fulfilled by you?
So we go to employers. The distribution of employers are, how many employees they have. By law, employers over have 100 employees, they have to provide the healthcare based on the ERISA law. Employers under 1,000 employees, they are spending the most money because they're buying what is called a full insurance. Employers who have more than 1,000 employees, most of them are self-insured. And without going too much of technicalities, in the self-insured, basically, it's very much like, the health insurance, the insurance you buy for your house, for your car. You take care of the maintenance part of the expenses, but you insure yourself against the unforeseen events, flood, fire, car accidents. So the self-insurance kind of provides that type of thing, because the employer pays for basically the per event, medical event of the employees, and the aggregate of the per event of the employee. And above that, they buy what is called the stop loss insurance. So they save them basically against the high. Mm-hmm. So what we have done with Bowtie, we have created a self-insurance model that can be applied to smaller employers, because complexity of that and the cost of that, not every employer can handle. And 60% of the employers in the US fit into that category. Mm-hmm. So we basically go to the employers, manufacturing, what have you. They have 200, 500, 300 employees. We say, first thing first, we recommend you to transfer from a full insurance to a self-insurance. And you don't have to move a finger. We have created the structure, the umbrella of the captive. You come under the captive of Bowtie. And through this captive, basically, your employees get this 24/7 access to care team. Everyone has a dedicated care team. They can get it regardless of where they are. We advise them where to do shopping, and so forth. Just right after now, I'm going to talk to an employer who has a truck drivers. They can go anywhere. And then at the end, based on the data we have collected, these are the savings that you're going to accumulate under your basically self-insured plan, because you're self-insuring. It's like if you do a much better job in maintaining your house, your car, you're very happy. You pay the premium for the insurance that you never use.
Right.
That's correct. So, and we provide basically the stop loss. So we have created a turnkey vehicle for small employers to join this plan and benefit the savings. And this is the beginning. We think within basically 2, 3, 4, 5 years engagement, because of this acceleration of the engagement, as you said, the employees become more interested in their health, and then employers bring some of the saving back to the employees. That creates that community that we are paying for this together. We are in a neighborhood. We are paying for something, and you've seen it in the housing. People look after each other's neighborhoods, right? That concept could be created in the healthcare that we have started doing this as of this year.
That's really great. And I know I know you're coming up on time, so we'll wrap up here, but it's financial services and healthcare have been traditionally difficult to disrupt because there's so much paperwork, there's HIPAA laws, regulations. so much that you have to kind of account for. When do you anticipate, Dr. Daneshgari, that there will be massive changes in the way that we see healthcare today, and it'll be more towards a healthier model of life and living?
I think within the next, frankly, for two reasons, because both the federal government and employees no longer can afford the healthcare costs at this level.
Mhm.
That's why every presidential election becomes number one solution. And this model actually, it doesn't need going through the act of Congress. The changes that I propose in the book don't need to go through the massive legislations. With a couple of executive orders, the gate can open, and actually the couple of administrations have opened this up. The first thing first is, and as you know, President Trump issued the price transparency law.
Mhm.
That has, although they're cheating through their teeth now, the hospitals and others, but it has a law and it will start taking effect that consumers need to start knowing about the prices of the services they pay.
Mhm.
The next one is the formation of called the Association of Healthcare, that the communities groups together, they can form and basically do this self-insurance themselves.
Mhm.
Again, in the previous administration, it started, now kind of stopped in the courts, but I believe that would open the gate for this innovative, disruptive, and free market-based solutions to come to market. So
Yeah.
I'm very hopeful that within the next 5 to 10 years, you will see the blossom of this model. And I'll give you one thing before we hang up. As you may have seen, Amazon recently bought the One Medical. You
Yeah.
know, Amazon has enough money to go and buy hospitals because
Mhm.
hospitals make money. But Amazon and then CVS and Walgreens, they see that the future of healthcare is not to invest in the sick care. The future of the healthcare is to invest in this healthcare concept. And this
Mhm.
health guardianship, I think, is the futuristic kind of idea that would lead these initiatives on focusing on the healthcare.
Yeah, congratulations. I'm glad you're doing this and changing the model for all of us to live a healthier and more prosperous future. With that said, you are probably the best dressed guest that I've had on the podcast. He's wearing, for folks that are listening to the podcast, he's wearing a bow tie and a beautiful shirt and a coat. So well done on that. Where can people find you online and look you up or read your book?
My book is available on Amazon, Health Guardianship, Firouz Daneshgari. I'm on LinkedIn. I have Twitter, and I can tweet at FD Bowtie. And Google this time, as you saw, you can link in, and I'll be happy to share my email or contact points for your listeners.
That's great. Thank you so much, Dr. Daneshgari, for coming on the Anti-Aging Hacks show.
Thank you. This was a pleasure. It was a pleasure to meet you.